my name is Kayla, and I'm a student nurse at St. Xavier. Could you go ahead and validate your name and date of birth for me, please?
Kevin Jackson, 21102.
Okay. And I'll be recording a neurological assessment today. Is that all right with you?
That's fine.
Okay. So the first thing I'm going to have you do is say the words light, tight, and dynamite.
Light, tight, and dynamite.
Okay. Your speech is clear and articulate. The next thing I'm going to have you do is extend your arm out and touch your nose. Okay. Other hand. Okay. Now close your eyes and do it rapidly, please. Okay, a little faster. Okay. You have rapid, smooth, coordinated movement. And you were also able to touch your nose while your eyes were closed. Can you smile for me? Okay, now can you wrinkle your forehead? Okay, so your cranial nerve 7 is intact and also symmetrical. The next thing I'm going to ask you to do is stick out your tongue. So it is midline. So your cranial nerve 12 is intact. The next thing I'm going to ask you to do, or next thing I'm going to do, is assess your eyes. Your irises are brown and your sclera is white. Can you close your eyelids? Okay, so your eyelids don't have any lesions on them. They're not swollen. They're not red. Okay, go ahead and open them for me. Okay, great. And your eyelashes are also evenly distributed. I'm going to check your light reflexes, if that's okay with you.
That's fine.
Okay. Directly and consensually. Okay. 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 So, I notice that your eyes are converged and your pupils are constricted, so that means that accommodation is present as well. I'm going to have you focus on my pen light and move it vertical, horizontal, etc. Okay? Okay. So, I noticed that you have symmetrical parallel tracking of your eyes, and you were also, there was no twitching with any of your eye movement, and it was not excessive. So that means that your cranial nerve 3, 4, and 6 are intact, which is great. The next thing I'm going to have you do is open your mouth for me. Can you say off for me, please? Okay. So your oral mucosa and gums are moist, your gums aren't red, your teeth are in good shape. Okay. I can see the hard palate, see the soft palate. Okay, and lower your tongue some. Okay, so your gag reflex is intact as well, so that means that your cranial nerves 9 and 10 are intact. Can you go ahead and shrug up your shoulders? Okay, pressure, okay. And can you turn your head? Yes, okay, and this way, a little harder. Okay, so cranial nerve is intact, and you have strong movements that are also bilateral. Can you go ahead and walk in a straight line for me? Okay, and back, heel to toe, and back. Okay, heel walk only, and back. Okay, so I noticed your gait is smooth, coordinated, and well balanced. Your posture is erect and upright. You don't really slouch. And if you don't mind, can you turn this way for me? Okay, I'm going to lift your shirt. Can you bend over and attempt to touch your toes? Okay. So your spine is aligned, and I don't notice any curvatures. I did palpate. You're able to bend down and forward flex. Do you have any pain or tenderness when you do that?
No.
Okay, great. Can you get your, actually, let me grab this chair for you. Hold on 1 second. Move over some, please. Okay, go ahead and have a seat in the chair. Now, can you draw a line from your toe to your shin? Yep, all the way up. Okay. And now with the other foot. Yep, there you go. So you have smooth coordinated movements, and you were also able to replicate on each side. So you had smooth coordinated bilateral movement. There's no curvature or excessive protrusions. Can you go ahead and stand up? Okay, I'm going to hold my arms out so that you don't have the opportunity to fall. So go ahead and close your eyes. Are your eyes closed?
Yeah.
Okay, so you can go ahead and open them. You have a negative Romberg since you were able to maintain control and did not lose your balance or sway at all. All right, so I think we're done for today. Do you have any questions or anything else that you want me to do?
No, ma'am.
Okay, thank you. Have a good day.